that is Raymond, that is human being.
That is her way of introducing people now. Um, we are so grateful that you came on the show today. I have this terrible, terrible habit of when I introduce our guest, the AI bots that, say whether or not something's AI, ding us for me being AI. So I have learned to ask our guests to introduce
Thank you.
themselves so we don't get
Hello
labeled as
everyone.
AI
I'm
generated.
Inyang
I do not
Takon.
know how
I'm
I
a
stand that the AI machines are like, yep,
neurodevelopmental
she's AI.
pediatrician, which refers to pediatricians specializing in children's development, brain, and cognition, and things around that. So, I practice here in the United Kingdom, and I have been a consultant pediatrician for over 30 years, but my specialty, I've been doing this work for over 20 years as a consultant in my hospital. So in the UK, I see children between the ages of 0 to 18, and I get referred children with neurodiversity, which spans from autism spectrum disorder or differences, ADHD, tic disorders, uh, motor coordination difficulties. I also see children with cerebral palsy, developmental delays, so quite a wide range of conditions. So I work in a team as well. So I, as a pediatrician, will see children, meet them with their parents, do the initial bits, and then I usually have other people I work with in a team, depending on what is needed. So that's what I do in my day to day. I also do other things apart from being a clinic doctor, and I host a podcast series called Early Intervention Matters, because my goal is to try and normalize the conversations around neurodiversity so that everybody can, you know, recognize other people's differences and make, you know, make the support available, and not try to change people, but making support available for them. And myself and my colleagues also co-founded an enterprise called School Doctor. School Doctor was set up to bridge the gap between the schools, the health professionals, and families, because sometimes it's such a big difficulty for children to be recognized as having difficulties at school and giving them the support and assessment they need. So we do lots of training for teachers, and run training for school staff, other people. Yeah, that's what I do on a day-to-day basis. So lovely to be here with you and Lee.
One of the reasons I wanted to have you on is I often get asked, because my first question when people are like, yeah, my child's been diagnosed autistic, I'm like, oh, so are they seeing the behavioral psychiatrist, the developmental pediatrician, or the neurologist? And everyone's like, oh, it was just the general practitioner. And my next question is, okay, how quickly are you getting to one of those three?
Yeah.
And
So I'll
parents are
answer
like,
that.
well, why do I need
So
a developmental
developmental pediatricians
pediatrician? Why
have
do they need
trained
a
first as general
neurologist to look
pediatricians
at them?
first. So
Doesn't
we've
the general
all had training
practitioner
as
know
general
what they're doing?
pediatricians before we then specialize as developmental pediatrician. And it's quite a skill that you need to have. So in terms of being able to understand, how the brain works in terms of development and behavior, you really need to have been working with children. You need to understand differences in behaviors, because not everything comes up with the same diagnosis. So if people are working from a point of, okay, these are just the symptoms and it's part of the diagnosis, there will be lots of errors. So the developmental pediatrician understands the phases of development of a child, understands what can be impacting that behavior, understands how to tease things out and differentiate between what it's an evolving pattern in the neurodiversity or what could be influencing the behavior. So take, for example, children or young people or even adults could have poor concentration if they are anxious. And if you're not thinking far and wide about why somebody might be anxious, might have poor concentration, you might just think, oh, they have ADHD. So you have to explore a lot of things and you have to understand. So it is very, very important. And also the developmental pediatrician understands that you have to work with other people. It's not just about giving the label and the diagnosis. The developmental pediatrician understands that for that child to be able to function properly and access what they need, you need to be able to work with the schools, you need to be able to educate other people around the child, you need to be able to explain the changes that could happen and how things could impact the child. So it's not just about giving the labels. It's beyond the labels. It's about, how do you understand what is going on and help to make things, supportive for that child. So a lot of what we do is advocating for the child as well, in terms of working with other people to understand that. And as a developmental pediatrician, you acquire those skills more. The neurologist, again, is a very they deal with things in terms of unpicking diseases, physical things as well. So they would go more around doing a lot of investigations. But the long-term care of the child, the developmental pediatrician is best placed. So I see lots of children up to from the time they've been diagnosed to when they're living to adulthood. So I'm part of the journey of that child's life. Oh,
I am so grateful for her, Lita's developmental pediatrician, and she is being distracted by the dog right now. We just had a thunderstorm and he has severe anxiety.
dear.
So he is acting out a little bit because he does not like thunderstorms. And it came right before his afternoon anxiety pill. But we were lucky or are lucky enough that she has a behavioral psychiatrist, a developmental pediatrician, and a neurologist all on the team. And the number of parents who are like, what do you mean team? Can't the general practitioner do it? And I'm like, it's not being mean to general practitioners, but they aren't specialized. And like you were talking about, there's a few times I have not caught something that was a developmental problem with Lita that her developmental pediatrician will catch and go, hey, is that because of her autism? Is that because she has the bad right
Yeah.
hip because she has a
Yeah.
deformed right hip from an injury? Or is that something else we're looking at? And I'm like, well, I am glad you are the one who studied all this because I do not have 18 years of my life to dedicate to studying all this. I think a lot of times the parents coming into this, I had the ability of having a team around me as a child and knowing you need those specialists. So I was like, yes, please hand me the specialist as soon as they were like, you want a specialist? Yes, please. But I think a lot of parents, they haven't had medical issues themselves. They haven't had a team of specialists around them. So they're wondering why they can't and trying to explain to them how amazing developmental pediatricians are. I get blank looks going,
Yeah. It
I
is
don't know
the
how it
same
is
thing,
in
and I was just
the
talking
United
about
Kingdom,
that
but
with
here in
one of my
America,
trainees
we
today.
don't give our general
And she was
pediatricians
telling
much
me about the
information
fact
about
she
autism. We
gave a
just kind of
talk
go,
to
there's
the
autism.
general pediatric trainees about how to support children with autism when they come into the hospital. And I said to her that was really good because people in the past used to have this notion that when a child with, say, autism comes in or ADHD or any neurodiversity, that they were only going to go into a certain place and be seen there. But I explained that we have children with autism are just like any other person. They get any of the illnesses that everyone gets. They need to see people for any of the conditions that everybody gets. And therefore, you can't say, or I don't have to know about it. You must know about it because you are going to be seeing them for different conditions, and you need to know how to support them. You need to know how to make your clinic environment reasonable for them to be, comfortable. Because I say when they get into the clinic and they're overwhelmed with so many things going on at the same time, the machines going, people just coming to them with different things, everybody, 3-4 staff coming to them without taking into consideration that those things are overwhelming. That child is going to shut down in your clinic. You're not going to be able to examine them. You're not going to be able to talk to them. You're not going to be able to see them properly and be able to unpick what's wrong with them. So it is really important. And a lot of general pediatricians, it's the same in the UK. In the emergency room, it's the same. Many people do not understand neurodiversity. And I think this is what we're trying to do now, is to educate people that, this is something you have to be aware of. It's not something you can shy away from because you need to be able to support the children. When they come in for any procedures, for bloods, for anything in the hospital, you need to understand how to support them in those spaces.
And coming from a child who is neurodivergent, sometimes we do things that you weren't expecting us to do because that is what we heard you say. Because I remember getting yelled at by my mom because I was going in for a scoliosis appointment, and the doctor's like, "Well, I need you to take your gown off," and he meant to just
That's
pull
a
it
very good
forward so he could see my
example. And you
back.
are
But he said,
right.
"Take your gown off," so I took
Over
the
the
entire
years,
thing
I
off,
have
and they're
learned
all
to
like,
make sure
"Why'd you
that
do that?" And I'm like,
things are
"But you
very
said
clear and,
take the gown off."
simple and not complex. Because as a doctor, you get trained and you just say things and you don't think about what you're saying. You just say it because you're trying to work out what is happening. But here, when you're dealing with, people who are neurodiverse, you have to check yourself. You have to think first before you say what you're saying so that it is clear to them. And you're very right. Many people don't do that. So it's something we're having to learn to reframe our language to make sure that it accommodates everybody.
And then with her developmental pediatrician, when he was like, "Well, does anyone else in the family have neurodiversity?" I'm like, me. And he's like, "When were you diagnosed?" I was like, back then it was considered
Yeah.
late for my ADHD because I wasn't diagnosed till I was 12, but that was late in the 90s. You were diagnosed at like 6 or 7. Now, when we say late, we're talking 30s or 40s. And he's like, "Yeah, honey, do you know how badly ADHD you had to be diagnosed in the 90s?" And I'm like, "I also had the autism diagnosis." And he's like, "Oh, okay, so she's autistic. I don't even have to finish." But he changed how he was talking to me, and I watched it in real
Mhm.
time. He's like, at first, "Okay,
Absolutely.
here's
It
how I'm
is. It
talking
is.
to you as
And I
a
think it's helped us
neurotypical
to
parent."
check
And
our
as soon as I said
practices.
I
And
was neurodiverse,
when I
he's like, "Yep,
started my job
okay, that's out the
initially,
window. We can
we
start
had to
going,
send
okay, here's the
questionnaires to
papers,
parents,
here's all this."
to complete. And many times we never really thought about the fact that parents that we're asking these questions could be neurodiverse themselves. We just expected that they would get on and complete the information and send to us. But over time, sometimes some parents just struggled. They could not do what was expected. And so they would come clinic after clinic and they would not have that information. And there was a lot of reasons behind that. Now we realize that, yes, a lot of parents who come in are neurodiverse themselves. And therefore we need to consider that as well. Yeah.
A lot of them were, I had to been really bad if you consider the fact they
Yeah.
diagnosed me in the 80s and 90s, and we were not diagnosing people back then.
Mm.
Nowadays, a lot of these parents are finding out with their kids that they're neurodiverse. And I know a lot of people are like, "Oh, so you found out with Lita?" I'm like, "No, no, I didn't." But that was one of the reasons,
Or
not just the neurodiverse. I've got some medical issues to go with it. But I had, back then, the psychiatrist, because it wasn't necessarily the developmental pediatrician. I had the neurologist. I had everyone and having people who talk to each other. And I think sometimes when I'm talking to parents, they're like, oh, my general practitioner doesn't talk to my child's other specialist. And her developmental pediatrician, Frank, can annoy therapists because he's calling up going, hi, you didn't tell me how she did in therapy this week. Especially when you were like going to therapy on a regular
Yes.
basis. Dr. Lopez would be like, hi, you didn't give me an update. And
Yes, I
I don't know
think
if
we
it's a
feel
thing
this
you've
quite a
seen
lot. And
in yours that
unfortunately,
you're kind of
because of
wanting more information about your
the
patients
increase
sometimes than
in
the
referrals
other people, the
and
team are
the
used to.
numbers of people that were needing assessments, we're getting less and less opportunity to work together in the same room. So in the past, it was really good. We would do assessments with, the speech and language therapist in the room. We would have schools invited to join the assessment. We would do all that, and we'll be able to have a period where we were collecting all that information and everyone kind of getting the information out to share that. As things have gone now, where it's really hard to get on the queue for an assessment. You find that people are working more in silos, doing the assessment, waiting to get information from the other person, and sometimes it can take a while before that information comes through. So you're not really getting the kind of joined up approach that you were getting several years ago, which is frustrating. And I think I always feel that in the best way, it's better to work together. I'm lucky because I also work privately, independently, and I do that work with some psychologists. And it's always quite useful that if we chat a lot. So when I see a child, and she's saying we'll chat together, we'll talk about that. If there are things that are unclear, we work out how we're going to get more information, we work out what's going to be done. And we do that over the phone and agree what we're going to do. So we don't have to wait writing letters to each other or email. We can do that over the phone and things get done quicker, and we come and agree on what we're doing. So I found that quite useful.
I've had a few parents who are like, really? Do you think that's useful? And I'm like, yeah, it actually is useful as the patient, even to have your medical team working together. And I know we can't seem over here in the US to keep up with the demand of how many kids are now being referred for, like you said, assessments.
Oh, we need so many new
i-
developmental
Is
pediatricians. There's a
that
shortage
something that we
everywhere.
need to be probably
In the
looking
UK,
at
we've got the
medical
same
schools,
problem. We've
suggesting
got
that
waiting lists.
people go into
So
developmental
we have a national health
pediatrics?
service, and we've also got the private practice as well. But for the national health service, which is free, people are referred there by their general practitioner. It can take up to 2 years before people get seen for the first time. And that's not in terms of concluding the assessments. It can take longer. There is a shortage of developmental pediatricians. But what has from that is also the fact that you've now also got people out there who are doing assessments who are not, should I say, as skilled as the people who should be doing it. So because there's such a demand, it's also brought the problem of sometimes people don't get the kind of detailed, comprehensive assessments they should be getting. So there is a huge problem, and there needs to be more done in terms of encouraging more people to do developmental pediatrics. I've always liked developmental pediatrics from when I was doing my training. So it's something that I've always liked and I've enjoyed it. I'm happy I chose that field. Well, I think we need to encourage more people to go into that field.
I know here in the US, we have our privatized health system. And I try to tell all new doc students, I'm like, if you want insurances to listen to you, they listen to neurologists and they
Yeah.
listen to developmental pediatricians. Those are God. Just if you want to be God, join those fields. I think
It's true.
neurological
Yeah, we
stop,
need
but
developmental
and they're all like,
pediatricians.
oh, I want to go
It
into
is
pediatrics. And I'm
causing
like,
a lot of
the insurance is
problems
never going to care about you.
for us. Yeah. 6 to 7 years. Wow.
We have states here where the wait time is 6 to 7 years before you
Wow.
can get in to see a developmental
I thought ours was
pediatrician
very
or a
fast.
pediatric neurologist.
Right.
Yeah. Our best states are at 3 to 4 years. And that was in like 2 years. She was lucky because her general pediatrician took one look at me one day and I'm like, she's got to get diagnosed because I cannot handle this anymore. And she's like, okay,
Okay.
I know how to get this done. And she went and yelled at our military insurance. And I
Wow.
had the referral before we left the office
Yeah.
and the appointment was 30 days
Wow.
later. And I'm like, thank you for knowing how to cut the red tape. But I mean, that is a miracle that we were just where someone's like, I know how to cut the red tape. I have so many questions because
Well, I
I
love
do not
watching
think people
children
understand how
develop, and
absolutely
I
not just
actually used
necessary
to.
developmental
So when I did
pediatricians are, but
my
you guys are cool. Like, you
training, I
know
went through
everything about
neonatology.
how kids
What really
develop.
fascinated me was that I could stay with the babies and try to, I just understood their quirks and the way they behaved. And there were little things they did, even from being a baby, that I found so interesting. And you could almost tell what a baby's behavior was going to evolve to sometimes by just watching them in those first few days and for the first few weeks. And so I got this interest in, in babies and how they develop. And so I think that kind of pushed my interest in developmental pediatrics as well. And just watching them evolve into their own persons, their behaviors, their differences, their interests. And just when things are not going, in the kind of right direction, you being able to pick that up, making sense of all that in the child's different environment, and just looking at what are the things that help make things better for that child. So I have found that really interesting, Phil. What has been most fulfilling for me as well is the difference it makes once you're able to, unpick and know what that child's differences mean. And when you're able to then, inform other people and help them to understand those behaviors that they were confused about, and then also help to support them in the classroom, in schools, help support parents. The life-changing experiences that everybody has when people understand what is wrong, that's what I've found. And I've been lucky to follow up children to adulthood, children doing different things, different interests of theirs, being very successful in doing the things that they're doing. And that has been very rewarding.
I wanted to circle back. She went
Yeah.
upstairs home. Her father just got home. That's why the dog went crazy. I was like, why is he upstairs barking? You guys do more than just autism as developmental pediatricians. You guys do Down syndrome, you do everything. Like, you guys really are the jack of all trades of knowing this is where a child should be and this is what I'm looking at.
Yes, you
Which
get to,
has
it
always
becomes
amazed
part
me
of
with
you. Yes,
every
we do
developmental
so many other
pediatrician
things.
I've
We
ever
see
met,
children
is
with
you guys
genetic
just
disorders, so you can
seem to
almost
just know
tell if
automatically
if
sometimes even
a
what's wrong with the
child's
child.
pattern is likely to be genetically, if there's chromosomal deletion. Now we've got very sophisticated genetic tests, so we can unpick things that couldn't be picked up before. I see children with epilepsy, so that's one of the things I do manage. I see children with seizures, different types of seizures, and I assess and I manage that as well. I see children with tick disorders and Tourette syndrome, and I do see children with different types of tics, and I manage that as well. I see children with ADHD, and I assess and manage that. Like I said, children with dyspraxia and motor coordination difficulties and how that impacts everyday functioning. I see that as well. And I also do joint working with a psychiatrist. So I have part of my qualification, I did a master's in clinical neuropsychiatry. So I do have experience in doing, some assessing some children with, basic presentations and being able to unpick if this could be just more than surface anxiety or mood problems. And if I feel that there are more concerns, I'm able to unpick that and support them and refer them to the psychiatrist. Yeah. So we do a lot of different things.
And you guys are, you
Yeah.
just mentioned
I
you
actually did
have
3
a master's
masters,
on top of having
3 different
everything else. I
masters. So
mean,
yes,
every
it's been very
developmental
useful.
pediatrician I know, it's
One
like,
of the ones
here's
I'd
my
liked
wall
is my
of
master's in
degrees.
public health as well, because I did that and I felt that that has been really good in helping me to educate people out there, because I feel that it's not just seeing one child in the clinic, it's about educating everybody around with awareness, which is what led me to developing the podcast, because I felt we need to get the message out there. We need to speak to different groups of people. We need to empower parents with knowledge, how to support their child, how to work with the schools, type of questions they need to ask. So yes, that's what led me to starting that podcast.
Mentioning the podcast series and the early intervention, having been an advocate for 20
It
years and
is
working with kids like
definitely
Lita,
life-changing.
and
And
across it, 'cause
sadly,
it's all
many
the
people
special
did not
needs kids that
recognize
I've worked with in the
what they
military.
were,
Early
what their children
intervention
had.
is
Sometimes the
life-changing.
schools didn't even know. A child who was restless and couldn't stay in school, sometimes the easiest way school would say is, well, you'll do part-time timetable. Or will exclude the child because the child can't be in school. They could not tease out and look at the pattern of why is this child distressed? Why is he not coping? Could there be a reason behind that? And so that's why we do a lot of training and teaching, and School Doctor does a lot of that with teaching and training the staff.
I know Lita went to Montessori for preschool, and her Montessori teacher was amazing. And one of the things she kept saying is she's having meltdowns because we can't communicate with her, because Lita was nonverbal at the time. And the school system who was providing the services was like, oh, she's just aggressive because that's why she's having meltdowns. And I'm like, no, you can.
Wasn't the aggressive one. The boy trying to throw the brick was. I hope that his anger issues resolved.
The boys in her class was throwing bricks, and that was considered appropriate for a male child, but a female child having a meltdown was considered aggressive by the school system.
And yet I was the one.
Yes, definitely.
And yet I was.
Yes, and we do see this,
Come on,
and it
people,
still
come on.
happens.
There was still a major double standard for autism, and there is still for women. But we were lucky enough because I had the team around me who knew how to get the school to deny her the services, so we could go to the military healthcare system and go, oopsie, they denied us. Can you
Yeah.
give it to us? And they
That
gave
was
her
lucky.
4 and
I don't know about the US,
4 days a
but
week of
it's so
speech therapy
difficult
when you're
for
3, 4, 5.
families to get speech
Get
therapy
you
input
talking.
for their child here.
And almost, we were lucky. The team of doctors we had around us knew exactly how to cut the red tape. And they're like,
Also one of them brought me coffee.
yeah, your general pediatrician, who was one of my friends, got to have that discussion with her nurse practitioner, because we get together on Saturday and she was giving her Starbucks Frappuccinos. And I'm like, I am not the one bringing this up at the next pediatric visit. You get to go tell your nurse practitioner what you gave the child. Because doctors are really good at
They
saying
never
one
stopped
thing.
bribing me in coffee.
Yeah, and she still got to explain that to her nurse practitioner, because I am not the one getting yelled at for the child.
Yeah.
Even with, over here, it's becoming harder and harder to get that early intervention. The CDC just changed it to where speech delays don't start until 36 months. So but they can't, if a doctor feels that they may see a speech delay, they can push it forward to the insurance company and to our child find and everything. For parents who might be listening who are like, my child is not babbling or,
I
talking
think
the
it's
way
good
I
to talk to your
should.
pediatrician early, because the early
Would
stages
you
before the
suggest they
speech
talk to their
actually comes
pediatrician
on,
about their
and you
child
want to
not
make
making
sure
milestones
that
they
those
think their
early
child
stages,
might
even if the
need to
child
make?
is not talking, but you want to make sure that those early stages of communication is coming on quite well, because you don't just wait till the child begins to talk. You want to look at whether other forms of communication, like the nonverbal, is the child making an effort? How is the child making their request known? You want to be able to see whether those building blocks are there, even if the actual word coming out uh, late. But it's better to talk to your pediatrician early.
With Lita, she did not have those early forms
Yeah,
of
exactly.
communications. Everyone else was like, "Oh,
Yeah,
she's such a
exactly.
good baby. She doesn't cry." And I'm sitting there. Now, her pediatrician, Conchita, was like, "Yeah, the baby should be crying. Like, she's in the
Yeah,
hospital.
exactly.
She should be crying."
Yeah, something. Yeah,
But
exactly.
everyone else
And
was like,
so,
"Oh,
and
it's
you do
such a
get this.
good,
Some
well-behaved
parents would
baby." And
say
we're
to
like,
us,
"She's
"Oh,"
not
because
crying
we
when
always
she's
go
wet.
back
She's not
asking
crying when
what
she
the
wants a bottle.
child was
She's
like
not
when they
crying
were
when she wants to be
younger.
picked up.
And someone said, "No, he
Something's
was
wrong
such a
here, people."
laid back baby. He would just feed and be content and wasn't demanding at all." And I was like, okay. Even when you were doing, some would say, even we're having a party next door or there's, she's just happy being there. I said, well, that's not what you would want. And like, the concerns were already there very early on. But because they don't recognize it, and like you said, people would say to them, oh, the baby was really good, you shouldn't worry. But yeah, I would recommend talking to your pediatrician quite early.
I know with her, when she had her injury at 11 months old that has caused the hip issue, I called
Yeah.
her pediatrician going, "Hey, I think you're meeting me at the emergency room." And
Yeah.
she's like, "What's that in the
Yeah.
background?" And I'm like, "Lita's crying." And she's like, "Yeah, I'm meeting you at the emergency room because that child doesn't cry." And it was like, so we know she does have some form of communication when she's in pain. But
Yeah.
having all that documented, that she wasn't crying, like, she could get shots and she wouldn't cry. She didn't cry, like I said, for being wet or
Yeah.
wanting,
It
and she
does. It does
babbling.
help. Do you
Having
get
all that
in the
documented
US? Do you
made it
have the
so much easier
standard
when we went to get the
2-year check?
services because it
Here
was
we
like,
have it
"Oh,
with the
it's
health
documented."
visitors. Yeah.
She, she's like, "What?" Her first few years, she was at the doctor's office all the
Okay.
time for other things. But yeah, you're supposed to have the standard 24 months check, 36-month check, and then 4 years, 5 years, and 6 years. Whether or not people do that, sometimes they're like, "I'll skip." And 2 years old is not a
Yeah.
vaccine, I don't think off the top of my head, but I've not seen the vaccine chart in a couple weeks. And I know that I know a few people just try to go when the vaccines are. We had a problem.
All right.
She got to go a lot more often because we had a problem with
Yeah.
one of the vaccines we gave her, got recalled, and then she got chickenpox, varicella so many times trying to make that legit. But it was not a doctor thing, and I am a very big proponent of vaccines, but we did find out, thankfully, because of all the issues we had getting her a legitimate varicella shot, that the state liked, that she is not inoculated
Yeah,
for measles.
exactly.
She has had her mumps, measles, rubella shot, so it was like, that is helpful to know, because once you get that vaccine, you kind of think they're inoculated. But that's, a one in a gazillion thing that you don't get inoculated. So vaccines are very important.
40 minutes in.
Thanks, kiddo. I have had some people go, "Do you think she got autism due to all the vaccines she had to have?"
You know what? And they call me the stupid one, and all you people are the stupid ones because you're not even thinking about science. Don't know what la la land you are living in, but even magic can't help you.
I'm like, "Have you met her father?" And I think she comes by it very naturally. I did want to ask, because you do have the medical background, and I get asked this a lot. And I know we don't know exactly where neurodivergency comes from, but I think we can all hazard a very good scientific guess where it comes from, knowing the parents. As a doctor, do you think there's, I'm trying to put
Um,
this a nice way.
so
Do
yes,
you think
I
it's probably
discussed this
just
on
like
one of the
a
podcasts
genetic
by
thing
Timothy. There's
versus
definitely
whatever
been an
crazy
increase in the
internet
numbers coming
conspiracy
in.
it is this week?
But what we don't know is why that is. So we know that, yes, there's increased awareness, but I think it's even more than that because we're finding that in families, sometimes you can get 2, 3 people being significantly affected. We're seeing that a lot more. There are lots of genetic studies being going on. We do know that, yes, in the family, there's obviously the genetic component to autism where there's a risk, if one of the parents is diagnosed. But we also, what's being researched again, is there been some modification from environmental issues that has, just changed the way the gene makeup is and causing that. We don't know. But I think in a few years, we will have more answers because there's definitely been a surge in, referrals. I remember when I started working, we got more referrals for things like cerebral palsy and developmental delay. We had a lot of referrals for that. Now, with that's been completely flipped on its head, we get lots of referrals every week for autism spectrum disorder and some for ADHD. And there we can go weeks and months without getting a referral for cerebral palsy. This is how much things have changed in the space of, over 10, 15 years, that the referral pattern coming in has completely changed. You're getting much more referrals for autism assessment and almost nothing every week for cerebral palsy. So it is interesting. But on the other side, we used to have a lot of preterm infants or children who had cerebral palsy in the end. But because of the good care that's been offered, we're having fewer children having cerebral palsy. But what we don't know is how many more of those children who haven't presented with the physical aspect could end up developing autism in future. So there's a lot of research about quite a number of things. Has there been some what we call epigenetics? Has there been some kind of modification of our genes with the environmental issues, changed the nature of the gene and then made us more susceptible to neurodiversity, the familial aspect. So there are quite a lot of things, but research is going on this. 5 big.
Some of the crazy ones I have heard recently that when I said internet conspiracy, it was things like
The what?
someone suggested that it was the font we were using in children's book causing autism, and I'm like, well,
Unless it's radioactive, no.
we'll put the physics to the side on radioactive ink because after 45 there's radioactive ink all over the place. But no, someone was suggesting that like the font, like we get like the crazy internet theories tossed at us, like the
Yes,
font that
it's-
we have in our children's books is causing autism. And that's what I was like,
This isn't a DC comic. This isn't a superhero comic.
when I was going crazy, the crazy internet theories was more like, are you kidding me? You wrote that down, you read that back, and you thought that that was a legitimate theory that
I
caused
don't
autism.
think we're the ones with the problem. I don't think we're the ones with the mental stunt.
I mean, an environmental change, and this is coming. I know I am not in biology or evolutionary biology or medicine,
No,
but I have my
no,
PhD in
I
quantum
don't
and
see how
theoretical
that font in
physics.
the
An
book
environmental
could
change
cause
would
that.
cause something like this,
Because
but that doesn't necessarily mean it's the font in the book or the colors being used.
exactly.
I've also heard, well, it's a color of ink colors we're using on
Yeah,
toys for
it's
kids.
not-
I'm
it's
That's causing
sorry, you
ADHD.
want all the children
That's
to
not
be
feasible, really,
colorblind and
because there are
only
lots
see
of
gray
children who
everywhere. We all
exposed
don't
to
want
any of these things
colorblind
who are
children.
coming up with autism.
So I
That's what
don't
I
know
meant
if
by
you've seen the outside world, but colors exist. no matter what, the outside world, even if we didn't have everything humans made, the outside world still has color. Human beings invent color.
Wow.
I don't think Britain millennials went through what American millennials went through. The millennial parents decided they were going to do only beige and gray toys for their kids and beige and gray rooms. And they're
Yeah,
seeing
so
this.
Gen Betas in the US is gonna all be colorblind.
I know.
That is not going to cause color blindness, but it has seemingly caused a bunch of you Gen Alpha and Gen Beta guys to go, neon colors exist. And I'm like, we did not need to go back to the 80s for those neon. I'm like, I want to go find all my millennial friends who raise their kids with beige and gray going, see, this is what happens when you deprive kids of colors. Autistic. But they're the crazy internet theories I was talking about. Because there's
those
definitely
aren't
an
the
increase.
worst.
Yeah.
And I can't remember them because I had to lock them in the vault.
You're like, they were so stupid. I locked them in a vault of my mind.
Really? Wow.
I do know, like with the military, U.S. military, there's a extremely high level of autism. It's 3 out of every 5 military kids has autism, which is a bit high. And maybe it's because they're now starting to
Honestly,
find
that's
out
quite
that all the
interesting.
military guys have autism too now that they're allowing them to serve openly and get diagnoses. And I'm like, I am interested in the studies you guys need to be doing on you. And I know Princeton just came out with a new study on stuff, but I haven't been able to look at it. They also came out with a new study suggesting that we go back to having different types of autism and
This is
basing
why,
therapies off of
people have to
where
bring
you
things
need
back
them.
to
And I'm
real
like,
life.
wow, we had to
So it's all
have a
good
study to figure
sometimes
out you
doing
need your
things in the
therapies based
lab
on
and doing, but
what you
people
need.
have to bring things to real life and how does it impact on young people everyday's life.
Well, we told you we would only get an hour. We're almost at the hour mark. We would love to have you come back on the program if you would and mind coming back on the program.
So my podcast is hosted on
For everyone who's listening or watching on YouTube,
www.drtakon.com.
where
So
can they
it's
find your podcast and
DRTAKON
all your information
.com.
online?
So that's where I host a lot of my podcast series, and it's also got information about me. And also this Cool Doctor Social Enterprise I was talking about, that's open to families who can connect from anywhere. And it's www, and it has a lot of information about what we do and how people can connect with us. There's a lot of useful resources. One of my co-founders has written lots of useful books for children and young people with different neurodiversity. That's quite easy to relate, right? So yes, there's a lot of information there about me. Yes, definitely we're okay with it.
We are putting together a resource page on our podcast website, and we would love to include both of these on the resource page if you're okay with it. Wonderful. I have gotten so many people even just stopping me at Starbucks now that she's got her dance studio here going, hi, you're that mom of that autistic kid. I need a resource. And I'm like, I cannot remember everything off the top of my head. It's all going on a podcast. Still.
Okay, I know I'm autistic. I still have name. If they could remember that, that would be nice. I know it's a hard name that isn't really used in America, and yet
You're
it's
right,
used
Lita.
a lot
You're
in the rest of the world.
absolutely
Like, I still got name. I'm not offended by the autism part. I'm not really fine with that part, but I still got name.
You're very right,
She
Lita.
is a little bit of
We try to get people to
infantilization of
understand
autistic people
that,
still on this side of the
I
pond.
still got name.
you
Also, I'm
have to
14.
people have to move away from trying to put people in a little box. People are people, and you call them by their names, and they've got their strengths. They can do a lot of things as well and relate to them normally. That's what we encourage people to do. So, Lita, you're very right. Yeah. Yes.
And
not, and that's what we want
the
to get people
spectrum
to
is a spectrum,
understand.
which I don't
That
think
you can't
everyone
just
completely understands.
you've got to recognize
And
people
it's not a
and their
linear
strengths
spectrum.
and their abilities, just like you're doing with everybody else. You don't suddenly think, oh, because that person's got autism, then they lose every other part of themselves. That's not right. That's what we want to move away from.
I had an
Wow.
intern who, when she found out that Lita was autistic, was like, well, I could never work for anyone who's autistic. And I'm like, maybe not the best thing to say to your autistic boss as an intern. But she thought she was sympathizing with me over having an autistic child. And I'm like,
Exactly.
I would just check
Exactly.
the boss's
Yeah.
medical history.
we shouldn't have to announce my
Mm.
medical history for you not to say that in the middle of a meeting.
Thank you.
they
Thank
learned
you
their
for
lesson, though.
Who
inviting
says
me.
that
But
about
yeah.
somebody else's
Well, no, it's
child?
been great. It's been
That's
great
just plain
joining
rude.
you and Lita
It was.
to have a
But thank you, Dr.
conversation, and I've
Takin, for
enjoyed it.
coming
And
on.
thank you,
We are
Lita,
going
for
to have you on
your
again.
contributions,
And
because I think it's
we
really
can't wait
great
to talk to you
to,
again.
you
Mhm.
teach us doctors and professionals about things. I've learned a lot from the young people that I do, see day to day. They've taught me a great deal, and I'm always very grateful, because I say that they've made me a better doctor, and I think that these are the kind of things that we need to be sharing out there. And thank you, Lita, for being out there and expressing yourself, and helping the doctors and everybody else to understand how it's better, ways in which people can communicate better. Thank you. Thank you. Well, thank you.
You can say thank you.
And you too. Thank
Oh,
you.
yes, that is a
Thank
word.
you.
Thank you. Yes.
Do I have to?
Yes, what?
She gets very shy still. Thank you so much, Dr. Takin. Thank you for everything, and we'll talk to you soon.
Well, thank you for watching the podcast, and please subscribe, and also look at the adorable paper. So if you want to subscribe for it, and also please leave a like, and don't forget, if you subscribe to us, if you won't miss any of our new podcast feeds, and also did you see the adorable paper? Don't you like it?